If you're experiencing pain in the end stages when lifting up your shoulder, and if you're finding that the symptoms are deteriorating, you may be dealing with impingement of the shoulder. In today's video, we'll be discussing about what is impingement, its causes, tests and exercises. Hi, I'm Awina D'Souza, Masters of MSk and Sports Physiotherapy, and I also help people above the age of 50 to regain confidence and strength. The rotator cuff muscles are a group of 4 muscles. It can be visualized as 4 rubber bands securing the golf ball to the shoulder. When a person assumes a slouched posture for a long period of time, one of those bands can be pinched and hence producing impingement symptoms. We can now start off with interactive tests so that you can do this test at home and analyze if you have impingement syndrome. Lift up your hands sideways. And if towards the end you feel pain and symptoms, this test is positive. Keep your hands outstretched like this and rotate it inwards. If you have symptoms in this test, it's positive for impingement. Keeping your hands outstretched, rotating inwards and lifting up. If these 3 tests are positive, you may be dealing with shoulder impingement. Now that you got to know what is happening with your shoulder and you have confirmed that the impingement test is positive, let's dive in the rehabilitation. We'll break down this rehabilitation into 3 levels. Level 1 would be pain control, level 2 will be scapular control, and level 3 would be loading the shoulder. Let's start with the strengthening exercises. There I'm doing isometric strengthening, wherein I'm pressing my elbow into the wall. We can press the elbow in all the 4 directions such that all the muscles that surrounds the shoulder starts to strengthen. This helps to strengthen the shoulder muscles without causing any pain, as there is no movement happening in and around the joint. This is a very good exercise for beginner. The second exercise for reduction of pain would be pendulum exercises, which will help you to reduce pain eventually and faster. Let's start with level 2 exercises. Here I am doing archangels, wherein I'm pressing the shoulder muscles together, and this is the way I start training my upper traps, my mid traps and my lower traps. This will help to stabilize my scapula. I can also start off with doing shoulder arcs, wherein I'm using all the 4 muscles that is attached to the scapula, hence giving me a good coordinated exercises and making it sure for me to use all the muscles together. This exercise is great to build up the mind muscle connection of the shoulder joint. Coming up next is the shoulder tease. This is also another scapular stability exercises which also involves a bit of the pectoral muscles and gives a good stretch to the pecs. These initial scapular control exercises can be advanced by using weights. Here I'm using dumbbells. We can start with lifting up our shoulders with just simple weights and also then doing scapular retraction exercises just like this. After starting to strengthen the scapular control muscles, we can now start applying load or weight to the rotator cuff muscles. Here I am using a dumbbell to start strengthening my external rotators. You can start eventually or take up more weights as you go and progress. When you feel the weights are not giving you much of an effect and it's not paining much, you're not sore, you can start increasing the weights. Eventually you can start off with 1 kg, then 2, then 3, 5 and whatever and how much ever you can take ahead after that. Here I am doing multiple angle strengthening, wherein I am started to strengthen in 30 degrees, in 90 degrees, in 120 degree, and this will help me to kind of strengthen all the muscles equally, giving equal amount of strength and focus to all the muscle fibers. Here I am trying to strengthen the internal and external rotators again, but this is a different angle. This is the complete rehabilitation of impingement syndrome. However, if the person continues to have pain and symptoms still, it could mean the scapular muscles are dysfunctional, and by palpating any of the scapular muscles, you might find extreme tenderness. This can happen because of spasm, because of the constant pain that was present chronically or for a long period of time on your shoulder. Release this area and help your scapula to function or work properly. This can enable healing faster and can reduce pain around your shoulder joint drastically. Along with impingement syndrome, especially if you have impingement for a long period of time, you might have stiffness or hypomobility in your neck and your upper back. Make sure that you click over this video. That would direct you to next stretches. Comment below how you feel following this exercise guidelines and protocols, and hope to see you happy and healthy.